My name is Molly Esordi. I was just a few days ago a P4 student at the University of Michigan. I've since graduated. Excited to be starting my career as a pharmacist, and I'd like to practice in pediatric pharmacy, so I'll be starting a residency at Detroit Children's Hospital next year. So some of my roles changed drastically as far as what I was doing as a pharmacy technician. One of the new roles that we created was someone who was just delivering medications to the COVID floor. And so that was something that I was required to do when I was picking up shifts. And as well, I think that just speaks to, pharmacists are an essential healthcare provider right now. We had to do several things like preparing for if we had a code, if a patient was coding up there and they needed our help, how we would get people up there but have enough appropriate like PPE to protect us. And then, how many times we needed to be up there to be delivering medications and how we could safely deliver all their medications. And it was pretty different for us. We were used to, in my pharmacy, we were used to taking care of pediatrics, and now we were taking care of mostly adults. So there was a lot of like process changes that had to go into place. And so just a lot of teamwork and patience on our end. And I think it was like special for me to really see like in the real world, like how this was being played out, and really be a part of that. So related to COVID, a lot changed for me really, really fast in a short time frame. I remember it was my 8th rotation of 9, so getting very close to graduating, and it was the last week of that rotation when they made the announcement that all students were being pulled from rotations and weren't allowed to basically enter the hospital for learning experiences. And so we got communication from the college daily kind of saying, like, hang in there with us. We're gonna get you guys through this. But it was a really scary time because it was like, are we gonna graduate? How are we gonna finish our rotations? Are we gonna get the necessary learning that we need to be pharmacists? So eventually that was all kind of resolved with a stay-at-home rotation and was able to graduate on time. But during that time and like that waiting period, and while I was staying at home, I also previously had a job at the University of Michigan Hospital as a pharmacy intern and pharmacy basically technician. And so during this time, they needed a lot of extra help with how many extra patients they were seeing because of COVID. And so I started picking up a lot of shifts. They, for example, like added an extra person on the midnights. So I was usually working midnights and then waking up in the morning and having Zoom meetings the next morning and getting projects and things done. But for me, it was awesome to be there and be at the hospital because I feel like so many people are just staying at home, watching the news, reading their emails, but to be there and to like be on the front lines and see what's going on was like one of the most beneficial things for my pharmacy career. And I feel like it really speaks to what we do as pharmacists. Like we're, supposed to be one of the most like accessible healthcare professions. And so for me, being there and seeing that and being able to come home to my family and say like, it's okay, this is what we're doing, or they have plans for this, or they have all these plans, and to kind of like, especially like my friends, my family, to be that person to like settle them down and let them know. I feel like that was kind of me like jumping into being a pharmacist really early on and really speaking to what we can do as pharmacists. I'm so glad to have you guys as part of this year's Pharmacy Scholars Program. I think you all are going to be blown away by what this college has to offer. I've certainly got to live through it the past 4 years, and I hope you enjoy your time and go blue.